Hi, everybody. I'm Susannah, she, her, pelvic physiotherapist with Core Connection, and just wanted to cover some ways that you can prepare and how you can rehab after hysterectomy, and some information as well about how hormones impact your pelvic floor. So, we're looking to prevent problems down the road and support you to have the best surgical outcomes possible. So, that's me. Why hysterectomy? So, for some people, it's gender affirming care to have the uterus or the reproductive organ removed. Some folks have it because of fibroids, endometriosis, adenomyosis. Some people are having a lot of bleeding, heavy bleeding, and some people have hysterectomy because of prolapse or because of cancer diagnosis. So, some questions to ask your surgeon before you have surgery. And of course, if you don't like the answers, you can ask for other options or you can ask for a referral to another surgeon. I recognize that in some people's situations, it can be very difficult to access a second opinion, but I just wanted to promote that as an option when it is available. So, asking, will my ovaries be removed? Will my cervix be removed? What are some signs of hormone deficiency? So, low estradiol, low progesterone, low testosterone. Am I a candidate for HRT? So that's hormone replacement therapy. Why or why not? How could this surgery affect my sexual function? So for some people, their cervix is a big part of their sexual function, their arousal, their pleasure. So that's a great question to ask. And then where will my incisions be? So depending on what type of surgery you're having, the incisions might be on your abdominal area. They might be tiny little incisions if it's laparoscopic, so where they put a camera inside. It might be a bigger incision on your abdomen, or it could be inside your vagina. So just to look at the pelvic organs. So in the front, you can see the bladder. In the middle, you can see the vagina going up and connecting into the uterus. And at the back, you can see the rectum. Underneath that sling type shape is your pelvic floor muscles. And the cervix is at the bottom of the uterus, between the uterus and the vagina. So your ovaries make hormones, estradiol, progesterone, and testosterone. So why is that important? Because when you have your uterus removed, you may have your ovaries removed or you may have your ovaries left in. And so in both cases, in the first case, if your uterus and your ovaries are removed, you will have surgical menopause, which means a sudden drop in these hormones in your body, and that can have quite significant impacts on you right away. In the second case, if your ovaries are left in, studies are showing that you may start your menopause sooner. It may be a more gradual transition or it may not, because the blood flow to the ovaries is affected by the removal of the uterus. So there's less blood flow going to the ovaries when the uterus is removed. And so you may have some of these hormone symptoms, low hormone symptoms, even if your ovaries are still there. So the term is surgical menopause, and that's when the ovaries are not making these hormones anymore, and so that can really impact our health. So what are the symptoms of low estrogen? We can get joint pain, so frozen shoulder is an example, plantar fasciitis. The tendons can get really unhappy, so a lot of tendonitis can happen with low estrogen. We can get night sweats, heart palpitations, migraines, loss of bone density, so we can develop osteoporosis, we can get hot flashes, vertigo, and the list is very, very long. So if you want a checklist for symptoms, you can go to Let's Talk Menopause, and they have a symptoms checklist there that you can look at. Low progesterone symptoms, the two top symptoms that you might find is poor sleep, 3 top symptoms. Poor sleep is one, anxiety is another, and low mood. So signs that you might have low testosterone, stiff joints, low motivation. You might have brain fog, so that could be forgetting people's names. It could be word finding difficulties, so you're looking for a word and it's not coming. It could be short-term memory loss, so looking at something and then 5 minutes later forgetting what you just saw. It can also show up as low energy, poor endurance, low mood, and low libido. So we touched on the pelvic floor a little bit earlier. What is your pelvic floor? So your pelvic floor is a set of muscles that are in a diamond shape at the bottom of your pelvis. They attach on your pubic bone in the front, on your sit bones, and then on your tailbone in the back. And they actually move up and down as you breathe. So the diaphragm and the pelvic floor move together. As we breathe in, they both go down. As we breathe out, they both come up. So what does your pelvic floor do? Number one, helps you pee and poo, and helps you keep pee and poo in. Number two, helps with blood flow, so that movement when you breathe, it acts like a pump, and it helps to circulate blood flow through your pelvis. Number three, sexual function. So orgasm is the contraction and relaxation of the pelvic floor, and the pelvic floor needs to soften, open, and relax in order for penetration to be comfortable and or pleasurable. Number four, core stability. So the pelvic floor is supporting the rest of your core and your abdominal canister. And then number five, it's supporting your organs. So I showed you earlier the bladder, the vagina, the uterus, and the rectum. The pelvic floor is supporting all of those organs as well. So how does low hormones, so if you have surgical menopause and your estradiol, progesterone, and testosterone are either dropping very quickly or they're dropping a bit more gradually, how does that affect your pelvic floor? So there's a condition called the genitourinary syndrome of menopause, and that is a collection of symptoms that happen when those hormones go down. So there's three categories of symptoms. One is genital, one is urinary, and one is sexual symptoms to look out for. So some of the genital changes you can notice. One is you might notice your labia are getting smaller, so the outer labia and the inner labia. Your skin may feel drier and less elastic. You might get little cracks in your skin from friction. You'll have less discharge from your vagina likely. The pH of your vagina can change, so that makes us more susceptible to infections like bacterial vaginosis, yeast infections, sexually transmitted infections, and urinary tract infections. So you might feel very uncomfortable with friction, so clothes might feel uncomfortable, underwear, pants, seams on pants, riding your bike might feel uncomfortable. And then the skin itself may get thinner. So that's all the way from the clitoris all the way to the anus. We can have those types of changes due to low estrogen and low testosterone. So some of the bladder symptoms we might get include, so urinary frequency would be peeing more than 6 to 8 times per day, or waking up more than once at night to go pee. You might be getting bladder infections, maybe you've had a few of them, and you might be getting bladder leaks. So you sneeze or you cough and you leak pee, or you're feeling very urgent to get to the washroom, and on your way to the washroom, you're leaking pee. So you may have had bladder leaks before and they're getting a lot worse, or you may have not had any bladder leaks before and now you suddenly have bladder leaks after surgery. So sexual symptoms that you might experience, decreased blood flow to the clitoris, so decreased or absent orgasm, shrinking of the clitoris, dry vagina, and you may have pain with friction or with penetration. So vaginal estrogen can help. This is something you can talk to your doctor about. And if your doctor doesn't know much about it, you can talk to someone else about it. So either a naturopath or get a referral to a doctor that specializes in hormone health. So vaginal estrogen comes in many forms, and you can try different ones to see what works best for you. Number one is a cream. So estradiol is one type of cream, and it can be applied from the clitoris all the way to the anus on the outside, and then you can use a finger to apply it on the inside of the vagina. The vagina and the bladder share a wall, and so some of the estrogen that goes into the vagina also gets absorbed into the bladder to help with those bladder symptoms I mentioned. A ring, so the one that we have in Canada is called the E string. It goes inside the vagina and stays in for 3 months. It releases estrogen while it's in there, and then you take it out and you replace it 3 months later. Tablet is like a little white pill that goes inside the vagina. So Vagifem is an example of that. And then an insert would be Invexi, and that's shaped like a little teardrop, and it's more oil-based, so it kind of melts inside the vagina and gets absorbed like that. So ways you can prep for surgery. We want to think about preparing your mind and your body, and also preparing your support system before you go in for hysterectomy. So mental prep, what can that look like? It can look like really understanding the surgery and the impacts that it's going to have in the short term, and possibly impacts that it may have in the long term, especially when it comes to your hormone health. We know that low estrogen can contribute to osteoporosis, and that is preventable. Nervous system care, so it could be things like meditation or yoga or breath work or therapy. Mental health support, and then building your post-op team. So that includes family and friends who might be supporting you with meals and anything else you might need help with when you are in your early recovery, as well as professionals that are helping you with your rehab and recovery. Ways to prepare your body before surgery. So making sure you're eating enough food. If you're under eating, that will definitely slow your recovery process. Drinking lots of water, balancing rest and exercise. So doing nothing isn't ideal, and doing too much is also depleting for the body. And consider seeing a pelvic physio before your surgery. Why would we do that? So one of the reasons would be to get a good understanding of how your core and your pelvic floor are working now, and just looking at if there's anything that can be improved upon before you go into surgery. So if you're going in with a strong and flexible pelvic floor, and you're going in with a good connection with your body and with your muscles, it's going to be a lot easier to recover afterwards. So learning how to connect with your pelvic floor. Seeing a pelvic physio can also allow you to address any pre-existing bladder symptoms, bowel symptoms, and sexual symptoms, so that you're going into surgery as mobile and as strong as you can. That will make the recovery much easier. So what to do in early recovery? One thing to do is to chew gum. That's because there can be pain from gas in your abdominal area, and chewing gum can really help reduce that discomfort. Take your pain meds as prescribed. Really want to stay on top of the pain in the first few days and weeks, because when we have a lot of pain, we're a lot less likely to take deep breaths, and we're a lot less likely to move our bodies. So the next point is taking slow, deep belly breaths to just encourage good expansion through the rib cage, expansion through the abdominals, so that you're maintaining good airflow. And preventing constipation is a big one. I'll just go back to constipation for a second. So some of the ways to prevent constipation would be making sure you're eating enough fiber, drinking enough water, doing some gentle movement, and some people might take stool softeners or psyllium husk to help support emptying their bowels. So early recovery. It's great if you can to see a pelvic physiotherapist at 2 weeks, 4 weeks, 6 weeks post-op. You may need support beyond that, but it's really great to have that support early on so that you're getting the right balance of movement and rest. Gentle core and pelvic floor exercises can start quite early. And some people go by the 5-5-5 rule. So 5 days in bed, 5 days around the bed, and 5 days around the house in the early recovery days. So doing too much too soon can be harmful to the recovery process, and doing nothing can also be less than ideal. So we want to find that sweet spot between the two. Recovery time. So depending on the type of surgery you have, if you have a vaginal or a laparoscopic surgery, so that's going in through the vagina or in through tiny little holes in your abdominal, in your belly, then it's going to take less time to recover. If they do a bigger cut through the abdomen, then it's going to be a longer recovery for most folks. So scar mobility. No matter whether your scars are tiny or bigger scars, we want to start to mobilize those at about 1 month post-op. So you start with light touch over the area, and then over time you slowly increase the amount of pressure that you're putting. It should never be more than a 3 out of 10 of discomfort when you're doing the scar massage. So you can do massage along the scar or across the scar. For laparoscopic scars, you can do little circles. And you can use vitamin E oil or bio oil to help soften the scar tissue. We want that scar tissue to move really well and to not be sensitive or tender. So what can physio help you with? Regaining your abdominal flexibility. So a lot of people after surgery have some tension through their front part of their body. We work on pelvic floor strengthening. We work on returning to lifting, so some sort of resistance training. The recommendation is 2 to 3 times a week for 20 to 30 minutes because we really want to promote bone health, especially for people assigned female at birth. We have a higher risk of osteoporosis or low bone density, so we want to promote getting back to some sort of strength training. Tailoring the exercise to your goals. So if you're someone who wants to get back to running, it may take a little bit more time to build your pelvic floor and your core and your strength back up to being able to run in a really strong and comfortable way. And then the other thing we support with is bladder, bowel, and sexual issues that might come up post-op. So feel free to reach out. That's my email, Susannah@coreconnectionphysio.com. If you have questions, please send me an email, and there's a QR code there too if you want to book in. Good luck.